Hi, Dr. Jim Jamison here from Youngstown Orthopaedics to talk with you about topics in joint replacement surgery. Today we're going to talk about going home after your surgery. In the last 6 to 7 years, there's been a significant change in the objectives for recovery for joint replacement surgery. Research shows that patients that are well informed, that know what to expect with their procedure, typically do a lot better. That's why we talk about issues in the office. There is a preoperative class for our patients to attend at the hospitals, and we also have other resources like printed material and videos like this one to help inform patients about surgery. Going home is very important after your surgery. Patients that go home typically do a lot better. They're in their own environment, they're more comfortable, and they also avoid other complications that can be encountered in patients that stay in the hospital for too long or maybe go to other types of facilities after their surgery. Being able to get up and do things on your own means that you're going to recover a little quicker. Patients have less readmissions to the hospital and less problems overall if they're able to go home and are more comfortable. To go home, though, you need to have things lined up ahead of time. Patients who have family members that live with them always makes that easier. If you don't have someone that lives with you, if you're alone, then try to plan ahead of time so that you can have someone available to help you afterwards. Maybe a relative or a close friend or a neighbor that's willing to come and help you out. It's good to have someone check in on you a couple times a day and also to have someone available to help you out with meals. A little bit of planning ahead of time goes a long way to helping with your recovery afterwards. The typical recovery for joint replacements is in the range of 4 to 6 weeks. We find that patients who have a higher activity level before surgery are more active, motivated, have their weight under control, and have a little bit of assistance typically do better. We want to have everyone end up in that group that recovers well. If you don't have anyone to help them and just aren't doing well enough in the hospital to go home and be safe, there are a number of good rehabilitation facilities here in the Mahoning Valley that are very helpful and can help you have a safe and successful recovery from your joint replacement. We'll talk about that if necessary. I hope you do well with your joint replacement surgery. Join me next time for another topic in joint replacements.